My name is Shyam Manoj. I serve as the Executive Vice President at CitiusTech. This is my 15th year with the company, 25 years in healthcare. I run the payer business and the platform business for CitiusTech. It's about a third of what we do for a living. Technology trends are the usual suspects, right? So cloud, data, AI, and so on. But I'm going to zero in on one specific challenge that most payers, most healthcare organizations, especially the large ones, are facing. I would call it the point systems sprawl. So think of each of the organizations have grown through acquisitions, solutions that have been procured from different vendors, different partners, and so on. And as an organization, if you're trying to innovate, it's just important for you to have interconnected, interoperable, seamless solutions in play. And when you have these different factions, different silos, 150 different suppliers, external products, etc., it's difficult to have a cohesive working unit, and that I think is one of the primary challenges. Obviously, the trends, you have to move to cloud. Now, how do you move each of these point solutions to cloud? Do you have one cloud strategy? Do you have multiple cloud strategy and hybrid cloud and so on and so forth? So these are all challenges that happens on a day-to-day basis. But I do believe the point solution sprawl is an important area that organizations have to deal with. And how do you look at it from a holistic perspective is going to be an important, especially if you are transitioning into or transforming your business into a digital business. So value-based care is not a new term. I mean, it's been in existence for many, many years now. One of the primary drivers behind the value-based care initiatives that organizations are focused on today is definitely the move towards government markets and the business that organizations are focused on, Medicare Advantage, ACA, and Medicaid business. What has happened with these three lines of business is that these are B2C business models predominantly. You have to cater to the member as compared to the traditional commercial business, which was catering to B2B business models, so to say. So what that means is you have to manage the population, the care that is being delivered to the population, at the same time transfer the risk to specialist organizations who are capable of delivering the care. The payers are being measured on quality, they are being measured on member satisfaction, they are being measured also on utilization. And one of the things that payers are doing is transferring that risk to specialist organizations. Now, we see a few different paradigms. One, standing up an enterprise-wide captive delivery capability. So you see a lot of large nationals and some of the mid-sized organizations acquiring provisioning or provider capabilities. So this could be primary care centers, home health centers, and so on and so forth. So that is one thing that we see in the market. We see the emergence of risk-bearing entities. Again, there are slices of or different types. There are at-home risk-bearing entities that go at risk for high equity population. Then you see specialist say for example renal care entities that go at risk only for the renal care population, because it's almost like a horses for courses strategy that is being employed here. All of them are ultimately driving towards delivering better care, better value for the membership that they go at risk for. Now, the technology challenges, while similar, I would like to say similar, not same. Data is a challenge, interoperability is a challenge, unified clinician experience is a challenge, and these are all areas that the risk-bearing entities as well as payers are acutely focused on. Now, Medicare Advantage has been a key focus area or primary focus area for most organizations, especially in the last decade. And the reasons are, there are quite a few reasons actually. One primary reason is the commercial business is stagnated a bit, and the reimbursement rates from Medicare Advantage for the membership, etc., are all supersedes what we see in some of the other markets. Having said that, reports have confirmed that the new eligible members coming into MA peaked in 2023. What that means is when you look at the next decade, you see the equity levels or the average equity levels of members in the MA space increasing. Add that to the tightening of regulatory initiatives focused on coding, codifying, HCCs, and so on and so forth. It is increasingly becoming a highly competitive space. Today, an average member has 40 to 45 different options that they can choose from, as compared to which is very different from what was available to them, say 5 years, 10 years back. So it is becoming a highly competitive business, and organizations, in addition to all of that, the investments that you need to make on medical management is also extremely important. So these are all pressures that you have to face and organize. There are incumbents who have done well, who have built out the base platform, who have built out the foundational infrastructure required to be able to support the MA population. And then you obviously have to pick and choose what is the business that you want to get into, and what are the ROIs and what are the benefits that you would you would generate out of getting into that. So so we see the next decade, while MA will continue to grow still, I think it is a really good business for most plans to get into. But at the same time, it really needs robust infrastructure and capabilities that you develop or deliver on a day-to-day basis. Yeah, you can't have a conversation today without talking about AI or Gen AI. So obviously we are still in year one, and the promise of AI and Gen AI is just phenomenal. I mean, the rate of innovation or the kind of things that we are seeing in the market is just phenomenal. There are a few different groups of innovation. So you have the hardware guys, you have the ecosystem players, you have the models itself, you have data app providers or use case providers, and these are all avenues or areas where innovation and disruption is happening. And this is I'm talking about in the generic sense of what is happening in the market. Few people have predicted 2030 is the year of singularity. Some say that will be advanced by 1-2 years. Some say it's already here, and so on. So there's a lot of buzz in the market. Some rightfully, some fearful, and so on. Specifically on healthcare, I think one of the first things that healthcare has to sort out to be able to deliver democratic AI-related innovation is to get the data right. So it's very easy to cook up, put five people in a garage, create a use case, do a pilot use case, what have you. But when you think about productizing it or taking it into the market and having it work in an actual setting, then you need all of the bells and whistles behind modernizing your data, cleanliness to your data, integrating it with different aspects, and so on and so forth. And I think healthcare organizations are at that stage. Now, that does not mean that we won't see innovative use cases in pockets, but I think organizations have to invest heavily on the data part of it first, so that the access to data in a structured form with the quality and the rigor that you require associated around it are all in place before you actually are able to rapid prototype, develop, deploy AI use case. So I think I'm pushing for the notion of AI as an architecture rather than AI as a use case, because that's an important concept that organizations have to imbibe into them, because you have to set up the foundation, and then it's not one specific use case that will work for you. It's the ability to create, deploy, multiple, validate use cases in the environment that will be really important for healthcare organizations. Obviously, M&A in any industry is an important way to achieve growth. I personally also believe that M&A is when you have run out of ideas on innovation. So, I mean, feel free to scratch that out. But at least I feel that consolidation is truly an absolute reality today. Organizations build consolidation, acquire membership, and it gives them leverage, it gives them revenue, it gives them profitability. These are all business models. The business model has to work before you can actually deliver value. So the technological challenges, I kind of mentioned this against the earlier question. I think what this has led to is what I internally call as this point system sprawl. I mean, you have you've acquired, if I talk about a payer, you've acquired the same capability. Actually, no, I shouldn't be using same. You've acquired a similar capability, but with very limited ability to reconcile or spend or invest the money to reconcile the capabilities. And now you have redundancy baked in because of the acquisition. So that has been an acute problem for most organizations that have grown through acquisitions. 20, 25 different claim systems, 5 different HEDIS systems, 3 different care management systems. The intent for the organization is to have a working functional model of one of these each that talks to each other in a correlated, cohesive manner. And that problem gets compounded when you have 10 of these each, which have been procured over many, many years. Now, couple that with consulting organizations, SI organizations, relationships, team members with SME expertise, etc. It is a nightmare. And the investment that you need to put in to be able to move beyond these technological challenges is significant. So, yeah, so absolutely an area that most organizations are focused on, and it's an incremental iterative game. Solving one key capability and what is needed for the business on an immediate basis.